A pinched nerve in the neck or cervical radiculopathy basically presents as pain that starts in the back of the neck, goes to the shoulder blade area, and then comes down the arm, usually on one side or another, with numbness or tingling radiating into the fingers. Pinched nerves can come from a number of different things. It's usually either a soft disc herniation, or it can happen from a bone spur or degenerative changes that are digging into the nerve. And it can happen at all ages, and it can happen in a younger person who the disc is herniated or popped out and pushing on the nerve, and it can happen to anybody who has degenerative changes in bone spurs in their neck, who over time is digging more and more into the nerve to make the nerve inflamed. It's fairly painful, so most people try to give it a couple of days and they see that they're not getting better. And as the pain starts coming down the arms more and more, most patients come in to find either their primary care physician or one of us. The most common thing to come and see us immediately is you have weakness of the arm. If your hand or arm function is diminished because of pain or because of weakness, then you should see us sooner rather than later. Most pinched nerves respond to conservative care. So most of the time we can calm down the nerve by calming down this inflammation with either medications or some physical therapy. Sometimes that doesn't work or the pain is severe and we need to consider doing cortisone shots in the neck, and that sometimes calms down the nerve. And so about 80% of people respond to giving it about 6 to 8 weeks of time, physical therapy, and or cortisone shots. Sometimes it doesn't, and there's great surgical options obviously available also. We don't have to touch the nerve, we just take the pressure off of it, take the bone spur or the soft disc herniation off the nerve, and allow for the nerve to recover. And most people have an instantaneous pain relief. Typically, it's a very instantaneous recovery. If we come to the front, there's not much pain associated with the surgery. We probably keep you in the hospital overnight, depending on the number of levels that are involved. And most people by 1 to 2 weeks are back to their normal life functions, and by 6 weeks we release them to most life activities. Recurrence of the pain can happen in about 10 to 15% of patients who have been treated conservatively. In those patients, we can start the process all over again with medications, physical therapy, and or cortisone shots. And if it happens over and over again, then those patients, we recommend surgical management in order to take the pressure off the nerves and take care of that problem definitively.